Reports indicate coronavirus death toll numbers may be far lower than what is being reported. Here's more on the figures.
Questions are being raised over how the U.S. counts the number of deaths from the coronavirus. Town Hall has reported many deaths tallied as being related to COVID-19 have actually been due to unrelated causes. This, partially due to the CDC's criteria for how death toll numbers are counted. According to the CDC, if a person tested positive for the virus and later died, they can be listed as a coronavirus-related death, even if they died from other complications.
I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death.
The CDC's guidelines appear to be even more broad, telling doctors if they even suspect that someone died from carrying the virus, it's okay to report that as a death from the coronavirus. According to a report by the Daily Beast last week, President Trump has privately raised concerns the CDC may be over-reporting the data, and has pressed the agency to reevaluate how those numbers are counted. However, many experts on the CDC have reportedly pushed back against those requests, saying there's a chance the numbers may actually be higher than what is being reported, including Dr. Anthony Fauci.
Most of us feel that the number of deaths are likely higher than that number because given the situation, particularly in New York City, when they were really strapped with a very serious challenge to their healthcare system, that there may have been people who died at home who did have COVID who were not counted as COVID because they never really got to the hospital.
However, other major public health experts have shared concerns of over-reporting, including Dr. Deborah Birx, who, according to the Washington Post, has told White House staff there is no data from the CDC she can trust, and has argued the agency's current guidelines may have inflated the number of reported deaths by as much as 25%. Further, some doctors have said they have felt pressure to add COVID-19 to people's death certificates. And currently under the CARES Act, hospitals receive extra funds for Medicare patients who are diagnosed with COVID-19, meaning there may be an incentive to over-report cases.
Hospital administrators might well want to see COVID-19 attached to a discharge summary or a death certificate. Why? Because if it's a straightforward garden variety pneumonia that a person is admitted to the hospital with, if they're on Medicare, typically the diagnosis-related group lump sum payment will be about $5,000. But if it's COVID-19 pneumonia, then it's $13,000. And if that COVID-19 pneumonia patient ends up on a ventilator, it goes to $39,000.
This all comes after the House passed a $3 trillion stimulus bill last week, which Republican leaders have said will likely be dead on arrival in the Senate. They are expected to vote on the massive bill following Memorial Day recess, which ends May 29th.